Well, good afternoon, everyone. We're here with John Elwell, CEO of Kno2, talking about some exciting news. I think John just recently released in the press that you are undertaking a strategic partnership with a company called CareEvolutions. Tell me a little bit about that and why a strategic partnership and why specifically with CareEvolution.
Absolutely. We're very excited about the partnership with CareEvolution, as you mentioned. I think that the way that I would define it, different than a standard partnership, and we have many, many important partnerships in our business. We call this one as a strategic partnership, given the unique nature of the position of both companies in the marketplace. As I typically do, I look through a very simple lens, that being a Venn diagram to say, where do the strengths of both organizations sit? How much overlay is there in that? And what does that mean to both companies and what does it mean to the market? In the case of Kno2 and Care Evolution, that very Venn diagram is about as aligned as it can get, meaning there's very little surface area crossing over in the middle. We have towering strengths of both organizations that can bring, in a combined effort, significantly more strength, the typical 1 + 1 = 3, into the marketplace, which then warrants the definition of this being a strategic partnership and the excitement that we're bringing. And I'm sure you can feel that in the announcement. We think this is really
Yeah,
important for the industry, really important for CareEv, and really important for our customers and future customers.
right. It sounds also like there's some significant synergies between the companies in terms of culture and the way they do business and so forth. Do you want to talk just a minute about that?
Yeah, no, absolutely. I mean, I think the easiest ways to understand that is to realize that many people don't know either company exists. CareEvolution does amazing work in the industry. They're often operating behind the scenes, performing incredible tasks for many healthcare IT companies and payers and other constituents. But many people don't know that. While at the same time, Kno2 largely private labels its technology in the marketplace. So we present ourselves under the covers of many EHR platforms, digital health platforms. What I mean by that is that we're not ego-led organizations. It's not about our logo. It's not about our brand. It's about what we do and the quality and impact we have in the industry. And we look to serve our partners as best as we can, partners and customers. So I think that's another level of depth and alignment that sits between both organizations. And in general, I've spent a lot of time with Trent. The way that they've built their organization, the way they run their organization, is very similar to us. So synergy across the board, not only in the tech stack and what we do, but how we run our businesses day to day as well.
Yeah, John, why now? What's special about now? Why not a couple of years ago? Why not, a year from now, 2 years from now? What makes now the right time?
It's an excellent question because I think some people look at this and say, "Gee, Kno2, we wish you would have done this 2 years ago. We could have used it then." For Trent, I'm sure at some point he may comment in the marketplace about that. But I will say that the marketplace has matured to a point where it's become, I think, imperative that both companies look at this opportunity together. What do I mean by that? As you know, and as everybody likely listening to this knows, healthcare continues to redefine itself. So things like TEFCA-Q and things like US CDI and FHIR, CCDA, HL7, I mean, on and on and on. As you know, we play a large role in EMS, and then now it's NEMSIS standard. There's all these ways in which data is being defined and structures in which it exists. And it's proliferating, it's not simplifying. So if you think about us as infrastructure and communication connectivity, where we're pushing all of that type of data and structure over our network, at the same time, those recipients, either on the sending or receiving side, have discrete needs. It could be in transformation of that payload. I want to take that from CDA to FHIR, FHIR to CDA, NEMSIS to CDA. Any number of combinations that they're seeking as healthcare continues to proliferate. And so now's the time. And we see that as a really important need in the marketplace, but when needed, not forced upon you. So our
Yeah.
business has always held the philosophy that our infrastructure supports all transactions, anywhere from a PDF as simple as a PDF, all the way up to as complex as the FHIR and CCDA exchange that happens, HL7 exchange that happens over our network. So as that continues to mature and we support the fluidity and pristine nature of the data coming over our pipes, at the same time, either the sender or the receiver at unique times has unique needs. And that's at this point where this partnership then brings that to bear and allows our customers, our partners, as well as CareEvolution's partners, to take advantage of that at the time in which they need it. So it's not self-described. It's not, you don't have to fit in our box We're saying use your box and then use our tools to make sure your box works. And we continue to have a lot of momentum around that philosophy, and we continue to maintain it. So this way we serve everybody for what they want and what they need when they need it, instead of saying this is who we are, you got to force yourself into our model.
Yeah, I
So we're
love
really
that.
excited about that flexibility that sits on the platform.
Yeah, that's fantastic. What do you think? Do you think there'll be additional value from a standpoint of broader adoption of uh, interoperability at scale? Do you think this helps that challenge?
I think it does from the standpoint that it's when you think about the number of systems, be it digital health platforms, EHRs, the number of systems today that are creating PHI. They've all adopted their own standards in which they're operating under. And so as that just continues to grow, the simpler we can make it so that those that have, just incredible technology to do incredible things in the marketplace, but struggle to broadly communicate effectively, if we can get them up and running sooner, because of this partnership
Yeah,
and the integration is lighter, time to market is faster, they can stay on their core competency while we maintain ours. I think it's a great advantage across the board. So making everything easier, which we strive to do every single day. The value is created at the time integration's done, not when it started. So if we can make the integration light and easy for our partners, then obviously we've made great strides in that
yeah,
regard as well. So I think there'll be many happy constituents with this
yeah.
capability.
Makes a lot of sense. What does the success of the strategic partnership look like to you, and maybe from a Kno2 perspective?
Yeah, I think most people would look at a question like that and say, very simply ROI. Meaning as you go into the partnership, obviously there'll be resources, both tangible and untangible resource allocated to the partnership. And so you're always seeking a return on that investment. I think that would be the traditional answer. And we both run very successful businesses. And of course, we want a return on investment in anything that we do. I go deeper in definition of a successful strategic partnership. It's not just about, something with a dollar sign in front of it. It's what have we done to aid them? Meaning, if we can maintain our unselfish stance, which, as you know, under my leadership and Trace's leadership, has been a key component of our culture,
Yep.
that we think about others before we think about ourselves, that we'll continue to do that in the marketplace. It's a critically important thing. So as we look at a strategic partner, the question is, have we made CareEvolution better? Right? Not just measured in dollars and cents, what opportunity, what exposure, what have we been able to do to benefit CareEvolution in this partnership? Knowing that if we do things right, that it's good for all.
Yeah,
Right? I've yet to see unselfishness fail, personally or professionally.
yeah,
And I think that it's a pretty good equation that leads to a lot of success. So I go a little bit beyond the dollar sign and say that this will be measured in success in both quantitative and qualitative terms. And I think both parties fully expect it, knowing that culturally, as you asked me earlier, there's a lot of alignment on that same topic.
yeah. Thank you very much for that. Do you guys have a roadmap for the strategic partnership? I think some of what you're talking about seems like just the tip of the iceberg of what we could do together, so to speak.
Yeah, we do. I'll be careful not to, because I always get in trouble when I open the kimono and everybody says, you got to stop talking about the future. But yes, there is a very clear roadmap between the two organizations. What we've announced is extremely exciting, and I think for many would be good enough. And what we are going to do initially is significant. But behind the scenes, there is a detailed roadmap of opportunity that we continue to assess prioritization of. Right, as we come to market with the highest priority, we will then continue to assess what comes next. We've got a laundry list of things to choose from, and that's what we know today. I'm sure as we're in market and people are experiencing the benefit of this, we'll get tremendous feedback on other things that may become priority based upon the actual use of the combined technology in the marketplace.
John, I was interested as I looked at the press release and just worked through some of the finer details. This is not creating a new data repository to do this. This is still operating in a stateless environment. Is that correct? And that appears to me to be a differentiator in the marketplace.
Well, not only are you correct, but it's critically important to how we view the world. Meaning, at the end of the day, we are not a repository. we believe the systems of record should maintain their stance, which is they are the system of record, where that clinical documentation is being captured. I mean, you know this, you're a provider. The data that you're putting into your system is you have a lot of confidence in, and you count on that. That is your data. You understand that data. You know where it came from, and it allows you to feel very comfortable in performing the practice.
Sure.
That needs to remain the same, meaning we shouldn't be interpreting your data for you. And when that data leaves your system and moves to another system, they should be confident that that's Dr. Schoch's data. That's how he viewed the patient at the time in which he took these clinical readings or whatever clinical information you put into the system. So we are not looking to be a repository, while at the same time, those repositories are working on different standards and different opportunities where some of this data normalization and data filtering and specificity that comes along with the partnership with CareEvolution will make the ends better, right? The edge, as we call it, even more comfortable in moving forward with interoperability and really, really starting to gain the benefit of it. So no, we are very loud and proud that we are not a repository. Your comment about stateless, I think, speaks to a couple things. Not only the fact that we are not touching that data in transit unless they asked to, which again, in the partnership, they'll have the ability to do, but it's also highly efficient because we're not concerned about building our own longitudinal record for our own use. We're not looking to take advantage of what transacts over our network for our own purposes. We stay focused to those systems of record that have both partnered with us as well as benefit from our pipes. And we are steadfast to stay in that position.
Yeah, makes a lot of sense. John, as we close here, I really appreciate your generosity with your time. Any further things that you would want the public to know just related to this partnership and CareEvolution? It certainly sounds exciting. We covered a lot of ground, but I want to leave some space if there's anything else that you would want to point out to the group or emphasize.
I don't know that it would be new. I would probably just summarize this as a thoughtful initiative. The teams have spent considerable time together, making sure that the combined technologies do represent the value that we instinctively thought that it did. So we've gone from instinct to doing the work to make sure that we believe there's tangible value. So as people read the press release or listen to this podcast, they should be comfortable that we've done the due diligence to ensure that there's value on the other end of this for everybody, and that you're working with two quality companies, companies you can trust, that are focused on the commitments we make, and the discussions that we've had on this call are very much what we're looking to achieve.
Wonderful, John. I will close it there. Thank you so much for your time today.
Thank you, Dr. Schoch.